So today we have Dr. Gupta with us. Am I pronouncing it right?
Gupte.
Dr. Gupta. We're so thrilled to have you on the podcast. And I've read your book and I want to show everyone it's
Oh,
amazing.
thank
I'm
you.
going to bring it so you can sign it next week. And yeah, happy to have you.
I am so excited for this connection. Thank you so much for this opportunity.
It's our pleasure. Dr. Gupte, I wanted to ask you what sparked your initial interest in hypnotherapy while you were a physician for a long time and you practiced in several places. As I record in, as I recall, I'm sorry, in India, Singapore, and
Dubai.
Dubai, right?
Yes.
Yes, yes.
Yeah, I think, and on top of it, I did my medical studies in Russia. So I have
Oh yeah, yeah. Not in India,
all over.
right? In Russia, yeah, yeah, yeah. But you went back and worked in India.
Yes.
Yes, yeah. So, what sparks your initial interest in hypnotherapy?
Many a times when we look back, we realize that many of new stories get written on the platform of some sort of trauma. And it's unfortunate, but maybe it is the universe's way to shake you up to think or do something outside the box. So there are usually, when I look at some motivational speakers or someone who is right now in a leadership position, there was always some pushback or something which happened, which made them start doing things differently. And I think for me as well, it was the same story because I always say that I was a very happy go lucky doctor. Love doing what I do because unawareness is a bliss, right? Ignorance
Yes,
is bliss.
that's true. That's true.
You're just happy. You're just doing what you're supposed to do. You're like
Yeah,
blindfolded. You don't know anything else. So everything is working out well. And
yeah.
I am the only medical professional in the family. I am the eldest daughter as well, which, as many of us know, has its own expectations, sometimes
Yes.
visible, sometimes invisible. And being the only person in the medical field, when I came back to India after finishing my studies, it was literally during my internship when my mom got diagnosed with cancer. And I remember, because I have visited those moments in my own sessions, that me as the young doctor coming out to heal the world, thinking, am I jinxed? I come back and my mom has cancer and she is a person I have never even seen sneeze in my life.
Oh,
And that was a huge shaking ground for me, where again, understanding that I was like, okay, I need to hold her hand and go through this. And things moved forward. We survived that chapter. My first job after coming out of the internship was in a cancer hospital.
yeah.
That is where we found out that she has a node and she has to go through the entire thing again. So, in that moment, I felt I am jinxed, I am cursed that I am bringing this. But now, on the hindsight, I look at it, that was the best thing that could happen because I was in touch with the best team, best oncologists. I was working for them at that time.
So you saw the silver lining in
Exactly. Which we often look at it later on, but when you are in
yes,
the trauma, you are like, why is it happening to us? What have we done? Everything was absolutely good. And things did not stop there. She, like a tigress, went through
yeah,
it all. I was her shadow. And I don't recall who was taking care of my younger sisters, how was the house running, who was
right.
taking care of my dad. It was just me and mom. And that's what my world was. And coming out of it, you feel okay, that thing is over. Whatever we went through, we
Yeah.
don't know how to deal with our emotions, right? You just brave it up and move forward in life. Then the clouds of depression starting to hit
Oh
with
yeah,
my
yeah,
mother. And I was married at that time. I was in Dubai, and she said that she has suicidal thoughts. But being the optimistic doctor, knowing that prescriptions are, we do. She is on
yeah.
antidepressants. She should be okay. I should just hold her, support her, and give the red flags to my family that, okay, do not leave her. And you don't ever think that the worst can happen.
Yeah,
That's why
yeah.
they say, don't treat your family members. I
Oh yeah.
learned it the hard way. And I was like, "You are on medications, mom. Everything is fine. I'm going to be with you if anything. Please call me anytime." And it was literally, Reem, a fraction of few minutes when
Oh,
it happened, and she jumped from the fifth floor of the building. It is miraculous that she survived it, because no one can survive it, because it's like the fall was broken by a parapet.
yeah.
And that is where my world as a doctor, as a physician, completely shook. I had no foundation. I felt I was questioning everything which I learned in the medical school through my mentors. And I was like, as a young doctor, then you say, what's the point of
Yeah.
medications? We were not doing enough. I was not doing enough. I'm not taught to do enough. What did I miss? And then feeling not good enough, the guilt trip, the regret. And I mentioned in my book as well that her nose, which completely got
Yeah.
lacerated, we did
It-
3 plastic surgeries,
Yeah.
and it just could not be fixed. And it was for me a reminder of a failure as a
Yeah.
doctor, because I would tear up looking at her, imagining that I failed her. I missed something. I should have done something more. You know how we play up
Yeah.
scenarios that this could have been
Es-
done, that could have been done.
Especially with family, you feel like responsible of making them feeling better. And if anything goes wrong, you feel like it's my responsibility. I'm the doctor of the family.
Exactly.
And even if someone didn't point a finger at you, you feel it. Like you can see, oh, she didn't do a good job.
Yes.
They might not think about it. It's just us.
It's us. We keep on filling up that invisible baggage,
Yes.
literally. And we don't
Yeah.
know how to deal with it. So we lug it around. And then
Yeah.
this shows in our practice, because now I feel extra responsible for my patients. I'm unable to have the family life balance because I bring my stress of my work at home, and I cannot understand why am I so stressed out, because subconsciously I am playing up that overcompensation which I could not do for my mother. Now, every patient, I am seeing a reflection. Again, it is invisible. It was not in my awareness at all. But
Yeah.
this was just stressing the system so much till I literally confessed to my father. And I was like, I feel so guilty. I feel, why am I even in this profession when I could not help my own mother? What
Yeah.
gives me the right to help others when you cannot do this? So we become very harsh on ourselves.
Yeah.
We,
Yeah.
and I know so many of the physicians will have the same voice, because we have gone through some episode or the other where we almost punish ourselves for
Yes.
that mistake, which was not even our mistake.
Yeah. That's true.
And my father literally at that moment said that things happen for a reason, the elderly wisdom. And he said, you will realize why it happened. And as
He's
I
very white.
my
Yeah.
book,
Yeah.
that is the day the doctor became a healer, because I started searching things outside the box. I started questioning what is missing in the medical system, and to see that how we take very easily physiology is going to be treated like this, psychology is a separate branch. And we
Yeah.
take it for granted. We all get
No.
trained like that,
Yeah.
till something makes us question, why is the mind and body separate, because both of them are impacting each other so equally. And
Yeah.
that is how Reem hypnotherapy happened to me, because when you seek you find. And it was just
Yes.
very casual invite by someone that hypnotherapy class is happening, would you like to join, Sonia? And I'm like, I am a curious learner, I would jump into anything new. And that those 2 days changed my life
Oh, wow. Wow. So,
completely.
can you share a pivotal moment in your journey, in your life, that is significantly shaped your approach in like various roles and endeavors?
I feel the first thing which sort of solidified my strides forward as a clinical hypnotherapist was to understand my own inner system.
Yeah.
Because when this training curriculum is very unique, that you just don't study in a classroom like how we do. You
Yeah.
have to put yourself into the shoes of the patient, of the client, meaning you have to become a client yourself.
Oh, yeah.
And I remember that first, I think it was a level 2 of the curriculum we were going through. And it was my turn to be the demo. So you become
Oh,
and you now tell what you would like to work on, and everyone is learning from the technique. And it was my turn. And my trainer said, "So, Sonia, what would you like to work on?" And the level of naivety, denial, unawareness, I was like, I
nice.
don't think I have issues. Life is good. I am here just out of curiosity. And mind you, this is going
Yeah.
backwards that, okay, at that time, this is what I'm doing. I did not know what purpose is opening up with this. And everyone is looking at me like, seriously? No issues?
But that's how you felt at that
Exactly.
moment.
Denial, complete denial. And I'm like, no issues. And then she's, so would you like to take this opportunity to jump into the
Mm,
zone to see if at all there is anything significant? And then I said, okay, I will. I have some issue logically. I understand how there is coping
mm.
mechanism there. So very physician like I'm
Oh,
explaining.
yeah.
I understand. And then she said, you understand, but you still have that issue. And I'm like, "Hmm, yeah, I logically understand, but I still have that issue." So she was like, okay, let's sit. Let's figure it out. And how beautifully my subconscious connected me to an event which somewhere I won't say it was forgotten, but it was not so prominent for me to connect it with the why of so many things, right?
Yeah. I tried hypnotherapy and
And that was
yeah,
when everything turned around. And
yeah.
I, that Sonia who said, I don't have any issues to work on 10 years, I am nonstop working on myself. This is the level of denial we all are in, because if these are corrupted files, every day there are things happening and we are storing it on the subconscious. We take
Yes.
shower every day, we brush our teeth, we do exercise, all that stuff. What about the mind? There are
We're doing it automatically, like we don't think about it.
ex-
Yeah. Yeah. And actually, your book made me think of everyone around me, even the people that I don't like their behavior or like I have trauma from. Or I was like, what did they go through? Like, felt so sad. I might got the opportunity to read your book or have the chance to know about hypnotherapy, but they lived their life knowing nothing and they don't have the opportunity. So I'm grateful for people like you, to be honest. And I wish that this knowledge would spread all over the world so they can combine modern medicine with hypnotherapy with holistic approach. And yeah, it's important.
yeah, this we are at the cusp of that paradigm shift. And through PTI and through so many physicians like yourself who are a part of this organization, it is the collective which is talking right now. And
Yeah.
I
Yeah.
myself felt, how will I do this change by myself when I entered into this field? And I now, after healing myself, I proudly say I have let go of my stethoscope because I found a new way not to treat but heal my patients. But it
Yes.
had a journey because we
Yeah.
attach so much to
Yes.
the physician tag, to the stethoscope. It has
Yeah.
expectations, it has ego, it has hard work, it has so much there. And I was at a breakdown point when I was moving to United States and thinking, now what will you do, Sonia? Will you practice traditional medicine or do you have the courage to let go and do this, which is calling you as your purpose?
Oh,
But
you're
yeah,
so brave. So
I'm
brave.
here now and connecting with PTI. I feel so empowered because this is the tribe. This is
Oh, yeah.
collective consciousness which has to move forward.
We're blessed to have you.
Thank you.
Trust me.
Thank you so much.
I have another question, which is what is the toughest challenges you faced while thinking of juggling like physician being like in Dubai, what I understood, you were like a physician and a hypnotherapist.
Yes.
So juggling those two, what's the toughest challenges and how did you overcome it?
So I think the main thing around my story and around many stories is emotions. We are not all cultures, all families have conscious parenting, which is a new term now. Our parents, grandparents, there are cultures, religions, there is the socio-economic condition. We don't know how to handle emotions. If you
Yes.
let it go, you are labeled as that very fussy, sensitive child.
Oh
If you
yeah.
suck it up, it is harming you because
Yes.
now you cannot even express where you are very vulnerable. So the same thing was there when these two zones appeared in front of me. I was very drawn to the hypnotherapist because what this physician could not do, the hypnotherapist was like, bring it on.
Yeah.
Let's go. Let's find out what is that emotional knot which is contributing to this dis-ease. It was
Mm.
exciting for me. But then at the same time, I was like, how can I let go of this? I am a doctor. It's like the ego kick.
The ego is for me, yeah, it's the most difficult thing to let go.
And being a physician is like literally you put all those years of your life into something, and like a Lego structure, you can poof, say, and you can
Yeah.
go in. And again, family expectations, judgment, your surrounding. I feel emotions were the biggest challenge for me because to be authentic to myself and my calling, I was not able to step into it to say, hey, now going to the clinic and writing prescriptions, I feel dead. That was what
Yeah.
was happening when I had to go. But the moment there is an open minded patient and I'm discussing, shift the couch. Let's understand why this gastritis is not healing despite all the medications and all of that. And there are emotional issues happening. Now that I had a different fire inside of me. But how do I be authentic to myself? So that was my biggest challenge. Though, as you very well said, no one is saying these things to us. Family is not saying, no one knows what's happening in our head. And then I became a trainer of this modality, even more empowered, I felt, because I'm now giving this modality, this science, this awareness to people. And that's where the physician was like, why am I still here?
Mm.
Why, what?
Yeah.
I cannot let go of you because you are my identity.
Yeah,
How?
but I feel like the physician, like when you were doing both, the physician attracted patients, like patients who never thought of hypnotherapy. And then you tried that, let's go to the couch. And then yeah. So I think although it's a challenge, but there is an advantage to it.
100% Reem. That is what I realized later on, that the physician is the credibility which is bringing people and their
Yeah.
confidence in me.
Yeah. Yeah.
Knowing that you are standing on that platform and it is the physician who has been holding hands of the hypnotherapist to heal in a different way. So now I have understand it is an integrated approach, but I had to integrate it within me. So my
Yeah.
biggest challenge was seeing them separately, not understanding how they can be together, but they were together. It was not
Mhm.
aware for myself.
Yeah. Yeah.
So yeah, emotions. And then the thought of, oh, this modality has to go out. It has to connect with people. That I call it my inner fire, because you feel
Yeah.
this is your purpose, this is your voice. But in Dubai, somewhere I felt that I'm hitting the glass ceiling. We
Mhm.
had the comforts of life, we had everything what anyone could ask for. And then suddenly, many people call it midlife crisis. You say, I'm going to a new land where I don't have a job, I don't know anyone, but I feel it's calling me. And everyone around you is, have you gone crazy? Why? You have everything here. What do you have a job offer? I said, no job. What are you going to do there? I myself was in trance Reem, because there was a bigger
Mhm.
purpose calling me in United States. We call it the
Yeah.
land of opportunities, land of dreams. And I
Right.
was like,
That.
this, it's not going to grow where I want to see it grow. It is United States. And we left everything and came here. And that was the most challenging year for me because I did not know anyone. No one knew me. And that was a very vulnerable call I had with my mentor, Yuvraj, while walking. And I was in tears. And I was like, why did I do that? I had everything, all the comforts, and people were coming to me, but there was this restlessness. You have everything, but something is missing. And
Yeah.
I left everything and now I'm here. No one knows me. And it was one sentence he said, which I took until now. I hold on to that. And he said, you have been brought here for a reason. You don't have to find your people will find you.
Oh, wow.
And I
Yeah.
am so blessed that I took that as my inner belief, because literally this is exactly what's happening.
Oh,
People just literally they're knocking in the sense on online. How did you hear about me? I ask everyone. The most bizarre story was an Uber person told me that I do Uber as fun. And I had a client, a passenger, and she had a session with you and she was narrating it to me. And I said, I have to connect with this person. Bizarre
Oh,
stories.
yes.
But you believe
Yes,
that someone up there is watching over you. And how
exactly.
AI
Yeah.
happened. It's just like all those miracles which combine together are magical, reassuring energies given to all of us that, hey, you are not alone. Just walk the path. Your tribe
Yes.
will connect with you. You will connect with your tribe. So, yeah,
Yes.
these are those moments of crumbling down and like a phoenix coming back from the ashes.
It's easier said than going through it. Like now
So,
you're talking about it, but I can imagine the difficulty and like the burnout that was associated with it. How do you manage the stress and burnout when facing those challenges, like in different occupations as a physician, as a hypnotherapy? How did you manage the burnout, the stress burnout associated with it?
yes. So, the stress and then leading to burnout, again, it has an inner story. We also all have experiences seeing certain of our colleagues who would not get stressed out, what generates stress in us.
Yes.
So stress is a very different definition for all of us because our inner makeup, what we have stored on the hard disk, our life experiences, our childhood, and our upbringing are different. So, this stress leading to burnout has a story which is a compiled or compilation effect based on what I have not dealt with from the past. So, that is what comes to awareness. Anytime you are feeling an emotion which is not matching the situation, the surrounding,
Yeah.
I have to understand it's a compilation effect. I need to go in to understand why am I feeling so anxious in this scenario. If it is
Oh, yeah.
obviously a life and death situation, you have to be in fight and flight. But why am I in fight and flight if XYZ is happening? This emotional response is not matching. That tells you there is a story, there is a compilation. So burnout only happens only when we have not let go of the past emotional baggage and we have just brushed it under the carpet. And that's why there is a need for physicians to come forward to say,
Yeah.
hey, I can be on that chair, like how I did. I can
Yeah.
be okay, I can be vulnerable. I can let go of where I felt as a failure because we are trying our best to stand on top of that, feel, to try to tell our own selves, no, I can do better. I can. But then there comes the imposter syndrome. Am I really good?
Yeah.
Because the base is not set in the right energy.
Yeah.
So it's as you ask, how have I dealt with it? That's what I preach, I practice. I train this
Yeah.
subject, so I live this subject.
So
Every
you healed yourself before healing other people. Yeah.
That's the most miraculous part, which I felt is missing somewhere out there. That when we become physicians, when we train as doctors, how much have we taken care of our own selves?
None, zero.
None,
Yeah.
exactly. And that's the reason we see the suicidal rates or people walking
Yeah.
out because they cannot take this stress and this pressure. There is so much unfinished they have not dealt with.
Yeah. Some, like I so many physicians, as they burn out, they can't be compassionate with their patients. That they become just a number, and that one thing from the reasons why I just can't do the traditional modern medicine approach and way.
And that's absolutely what you are saying is like when you have not dealt with something and the same emotion shows in front of you, it's a mirror reflection. And
Yeah.
now you will be very disturbed with this. So it's if the most resource you need to understand is for someone patience, and there is someone who is outside who is creating a scenario where you are feeling angry, you need to understand that there is something inside of you which has
Hmm.
not been dealt with. There is a pocket of anger which belongs to the past. That is where your patience is trapped.
Oh, yeah.
So the subconscious
So
is so resourceful. The problem is there, but the solution is also there. And
so
being
that brings
human,
another.
it's all about the emotions, as I said.
And it brings another question to my mind. Have you ever faced any ethical dilemma in your various role? Like how did you handle it and what did you think about it and how did you learn from the experience?
That's a very good question. I have to think about it because I'm pretty sure the field I'm in, there are so many things which are thrown at you in this new
Yeah.
role that you learn on the ground, literally. Give me a little bit more
Yeah,
understanding
sure.
when you say ethical.
Ethic when I see some physicians like I've seen in my short period of practicing the regular approach of medicine, some physician would take advantage of their let's say diploma or like their title, and it's for me it's ethical. If you're a physician you have to be 100% ethical. Like you won't do a procedure that you don't need just because you're selling. Like you're not a
Oh, yeah.
seller. You shouldn't, like I'm not saying you shouldn't be
Yeah.
paid,
Yeah.
but you
Yeah.
shouldn't think about how can I get this patient's money.
Yeah.
That's an
Yeah.
ethical
Yeah. Okay.
problem for
Got
me.
it.
Or like when I was practicing, one of the doctor professors I was with, I would never forget this. We were in some patient had COPD and she was an older lady. She was in so much like pain and she couldn't breathe and in like ventilator. But he didn't treat her well. He went to another patient where he knew someone from like this family's patient. So the approach was totally different and it broke my heart.
Yeah.
Like those two patients, like you don't, you shouldn't be treating one on their, let's say, societal level, or I don't know. It's for me that's ethical. Like those things I faced,
Yeah.
and I couldn't practice medicine in that environment.
No, that's absolutely that. When we see that the reason we are here is a part of us has to be empathetic. You cannot be a doctor if that is not in you. You should not be either. But yes, as you correctly said, but we become robotic, many of us.
Yes.
And those
Yeah.
of us who cannot become robotic now don't fit in
Yes. Yeah.
because we are too sensitive, according to
Yeah.
the others.
Yes.
Right?
My mom used to call me that word. You're too sensitive as a
Yeah.
doctor.
And they would say, suck it up and go.
Yes.
Because
Yeah.
well, how much can you feel for others? But no, this is a beautiful uniqueness in the physician, which has to
Yeah.
be understood, which should be empowered, I would say. And yes, now I understand in a better way what you were asking. So I have two examples from my life to share. One where I felt almost in a position where I was bullied as a young physician, and people who should be mentoring me
Yeah,
are
I remember
crushed me.
reading a story like this, and I'm sorry to say that, but I was so pissed off
Yes.
at that doctor. Oh my God.
Yes. So when your own try to crush you, and
Yeah.
before my career would could have even gone out, I see a possibility that maybe I would not have had a
Yeah.
license to practice at all. And that was just an ego game between two heads of departments where
Yeah.
the intern or a new doctor has gotten trapped. And that, as you said, when I wrote that chapter, I felt that I still had that anger in me. And that gave me the understanding that I've still not closed it fully.
Yeah.
That can lead
Yeah.
to authority issues in us, where you go boof with authority, which is part of self sabotage. It does not work. So, every instance from the past, when it gives you those goosebumps or the same emotion comes to you, that means that file is still active. The emotions are still raw in that. And that part of my life, which now again, on hindsight, I see with the support of my father, I found my voice and I stood up against this bully who is actually
Mm.
the head of the department and I'm just an intern.
Yeah.
I was like, what? You want me to complain against her? And he was like, yes, write it down in black and white. And if she does anything, I will drag her to court. We did not have any financial means to do that, Reem. I knew.
Yeah.
But it was the conviction of my father, that support which we all need, that no, do the right thing. Whatever happens, I am here. And
It's very important to have family, someone have had
someone.
your back.
Yes,
Yeah,
and we many times we look at our mentors in the field, right? When we are young,
yeah,
we look up to them because obviously there is someone who inspires us. And there are some who we feel, no, I am not going to be this doctor at all. But there
yes,
is that hand holding which happens everywhere. Everyone needs that mentor, that guiding force. But when that guiding force becomes your crusher, I think that is the biggest unethical thing, that people who are at the top in their games in medical field, they have to support the what we call from Star Wars younglings,
yeah,
to
yeah.
inspire them. We have to tell them what can go wrong and it's okay. It happens, and encourage them that this is how you deal with it. This is how
Learn from your
it works.
mistakes. It's okay.
Yeah, but we don't get that, right? Who
No,
gets
I've been bullied in my internship, yeah, and I didn't forget it until now. Like when you were talking, I remember then I have the same feeling. Like
yes.
I'm so angry. Why did she do that to me? Yeah,
Exactly.
yeah,
And the second memory which comes to me related to ethics of the physician happened when I already was studying hypnotherapy, connecting with that zone. Because, as you say, the sensitivity, I have that inner makeup as well. I feel my patient's emotions, and that used to make me feel I want to do more for them, and that empathetic chord was there. And we know, and there is pharmaceutical industry, we know the inside story, how, as you said, you write a test, there are incentives, this and that. So there was
yeah,
this, at that time it was new. I'm really not even aware of that test right now, where there is a genetic profile of the patient. They can tell you, and they can tell the patient, out of those 1,000 diseases, which one is a possibility or probability you can have, just through a
yeah, okay,
simple genetic
yeah,
test, a saliva test or something. So it was pretty new at that time, and it was
mhm,
a big money spender to, and those that company was promoting it to all the clinics. And they came to me with that representative being like, oh, you see all of this, and they can know if they're going to get Alzheimer's or dementia or there is
yeah,
a heart risk. And I'm like, oh my God, you want me to do that? I cannot play that role. Who am I to tell you that you are going to have dementia? No, this is not my role. And you are creating fear instead of reassurance.
exactly.
Nonsense.
That's what I thought of the first time. Yeah, yeah,
And I just walked out of that meeting, and they looked at me like some
yeah,
person who is just too proud or snooty or whatever. I was like, I'm sorry, I cannot be part of this. It is unethical for me personally, because what I was studying at that time was that genes don't control you, you control the genes, and the bridge is
yeah,
emotions.
yeah, yeah,
So you deal with your emotions, and even though there is a family history, there is a possibility it will not come to you. That disease will not come to you because you have understood how the mind and body works. And
yeah,
that was that zone of ethics, because I saw some of my colleagues who, again, not to judge them, but were unaware of the implications of something like this. So I feel we physicians have so much responsibility. Each word we speak is almost like a hypnotic suggestion for our patients. They are
yeah,
looking at us, our body language, the way we narrate a blood test, the way we showcase hope versus fear.
mm,
It's with us.
yeah.
And to present that in the right manner, we have to understand our own inner system. We
That's
cannot
true.
get trained in it. I know there is so much out there, but till you go and get your hands muddy in your own darkness, you cannot find the light.
Yeah, that's very true. That's very true. So, how do you think your diverse experiences have shaped your perspective in life and work?
By what, diverse you said? No.
Yeah, diverse experiences because as a experiences as a physician and experiences as a hypnotherapist, how did those shape your perspective on life and work?
So the main thing, as you said, that we have many hats and many roles in life. We are not only physicians or professionals. We are mothers, sisters, daughters, friend, and each role has a very different avatar of us which comes out.
Mhm.
And what this integration and this understanding and exploring my inner system has given me is that when a challenge comes my way, I can understand if there is something which needs to be tweaked within me for me to get clarity on how to handle this challenge. And that is a blessing because
Yes.
challenges rock your boat. You cannot think clearly and you make a rational decision, which you repent later on. Irrational
I'm
decision,
guilty.
which you
Yeah.
repent later.
Yes.
And it's that capability to see life through different glasses.
Yeah.
And as I mentioned, that if there is an emotional wave I'm feeling in any of these roles, which is not matching the actual scenario,
Yeah.
that means something is off. And to find your resources which are within you. I feel that is the biggest thing which I have learned as a physician, as a hypnotherapist. We often look for that support outside. We look for that encouragement outside. Someone should be there. But that all those resources, they are the emotional building blocks which are within us. So your
Yes.
subconscious has all the opposites. So where there
Yeah.
is fear, there is faith underneath. Where there is anger, there is acceptance underneath. Where there is sadness, there is happiness underneath. So if you have something which is huge, like a tower inside of you, your own opposite emotion is buried underneath. And
Yes.
that's where you go to rebuild yourself.
That makes sense. Yeah. Yeah. So, where do you see yourself in your various endeavors in like the next 5 or 10 years?
That painting I painted in the last chapter of my book. When I entered into this modality, when I found that passion
Hmm.
ignited. So it's literally stress versus passion. Both of them
Yeah.
will keep you rolling, but stress will burn you down. Passion will ignite more passion, and you are
Hmm.
unstoppable then. So that
I
shift
never thought
happened.
of it like this.
Yeah.
Yeah.
It's a both are go getters because people who are very stressed, they actually say stress is my fire. And I'm like, what if we shift with the platform of passion and motivation? And they're like, I never thought of that. Well, it will
Yes.
burn you out.
Yeah. I'm learning so much from you. What innovations or changes in your field of interest, which is hypnotherapy, excite you the most, and why?
So I personally feel that after the pandemic, I am sensing there is a lot of open mindedness in people. There is a lot of possibilities which are opening up where, that tucking like a chicken tag, which hypnosis,
Mhm.
hypnotherapy was carrying for decades or hundreds of years. It's we are able to shed it right now. So I am excited for the possibilities which are showing up right now where people are understanding or becoming more aware that prescriptions are okay for some time when it's a life saving drug. But
Yes.
to treat chronic illness, it is just a dependency. When they seek more, we will have more of us getting trained in a modality to give more. It's the demand and the giving
Yes.
out of that product or
Yeah.
something. So
Yeah.
for me, this is an exciting time to be at the right place at the right time, I would say, that people are looking for medical practitioners who are doing things differently, who are not so much in the chemical dependency, but to get that feeling of empowerment from within. And connecting with PTI, the second side of it, that there are medical professionals who are looking to enhance their toolbox. What can we
Yeah.
do more? How can we work around it and take our patients to the next step and heal them? So it's a win scenario for me, which I see as the direction moving forward and to bring the awareness of this subject, not only to people who are trapped in chronic physiological or psychological disease, but to the medical side as well, that there is more we can do. But of course, train yourself, get into it, and see how you feel about it because we need a task force here because this side is going to ask for more
Hmm.
and more. And there are very limited providers right now in this
Oh,
modality.
yeah. 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 So, can you share a personal story that had a significant impact on your life, either within or outside the professional world of yours?
significant impact? Okay, give me more context. Share
Like
a story
something,
of yours, Reem. That helps me.
uh, I have so many.
Yeah, just share one, and that inspires me to bring out something from my data bank.
Okay. Personal story. I'm the youngest female of my
Hmm.
family, and I have two brothers. One is an autistic, and one of who was preemie. And when he grew up, he was normal, but at the time, then back home, they didn't accept him in regular schools
Ah,
because his pronunciation of words
ah.
was or letters was not very good. But he was social, he was happy, he was everything. So maybe I didn't want to go into the medical field, but the expectations of my family, my dad was like, "So I don't have any doctors and I want a doctor. You're the one who's gonna go."
Hmm.
So what kept me going is those two brothers. And in 2016, I lost my brother who was preemie.
Oh,
And that was a shift, like it shook me. I was like, he could have lived if there was a change and knowledge and awareness of changing lifestyle. But there was none. My family, like my parents, were very good parents, but they are like limited in education and no one educated them. Like we don't have this awareness, social awareness by the time then. So yeah, that was a life shifting moments for me.
yeah, yeah. Thank you so much for sharing that. Again, as I said, there is usually somehow trauma behind
Oh
which
yeah,
makes us think differently or see things differently. So, by my personal story with my mother and her suicide attempt was that one thing which shook me. And when I hear you, it reminds me of my role as a mother. So, that story has me as a daughter.
yeah.
And as a mother, I have two beautiful sons, and the firstborn and the secondborn, there is a difference of six
Oh
years
yeah.
between them.
Oh,
And the
I-
first child, being the first child, he was always on autopilot. I did not have to sit with him, do homeworks, and everyone used to be like, "How?" And I'm like, "Wow, good. He's doing what he
mm,
has to do." And he was on his journey. And the little one, when he came, he was very different. And at
mm,
that time, I did not fully have immersed in this hypnotherapy zone. So the first hit was my mother's thing. And the second hit came to me as a mother when my child is not fitting in the box and he is not behaving in the normal way as society says. And we are not
no.
understanding what's happening. He has speech delay. He has certain habits which are repetitive, which at a very young age look like OCD. And the doctor in me is, what's wrong with him? And again, when you are in the unawareness and you go out in the social environment, again, people are not aware of things and they
Yeah.
judge things because we had a live-in house help at that time. I was working full time and a very so-called, I don't know, I should not say naive, it is intentional, I think, a comment that, yeah, what will kids learn when they are left with house help at
Oh
home?
yeah.
Again, a judgment that, oh,
Mm,
he is so drawn to the broom or something because this is what he's seeing in the house. And you are also in the unawareness and it hits you. And what you do to cope up with it, I don't want to go out. I don't want to socialize. I don't want to meet gatherings and go out in gatherings because I feel there is something wrong with my kid. And I don't know what is wrong because he is so young. And then the understanding the speech delay was because there was repeated infections and there is fluid, there are grommets which are inserted. Still, things are not so working in the way we expected. That became also additional focus for me to
mm,
understand how do I deal with this because this was creating chaos in our household because we were expecting something from this child he was unable to give. We were not understanding him, and the most frustrating part at that time for me as a physician was that he was not fitting in any criteria so-called medical criteria. Is he autistic? Is he spectrum child? Is he? No, but there are delays. And with that, again, the emotional war which you have to deal with, the isolation you create to
Yeah.
go away from shame and judgment because no one is understanding you.
It's you trying to be safe. Like,
Exactly. By
yeah.
doing this,
Yeah.
which is never the right way. And
Yes.
that pushed me even more to understand the why of things. And later on in the field of hypnotherapy, as it happened around that time only, the understanding that this beautiful soul has chosen us as parents because we
Yeah.
are going to nurture him the way he is, not trying to mold him in the way we or society wants. And
Exactly.
literally in that moment, Reem, our family became the happiest family. It is the acceptance of what is and not what people will say. The moment I looked at my child that I don't have to shape him, he has come with his own inner program. I just have to nurture to his needs. I let go of my own expectations as the mother and I see him blossom. He is the happiest kid around. In school, he is called the sunshine, and he is that sunshine for us. And now, because we don't have those expectations on him, there is no stress in the house at all. We accept him the way he is. So that was a huge learning for me. Again, going inwards to understand my own stress. I was fearful of judgment. I was fearful of being shamed or being labeled as a inadequate mother. But then you deal with it and no one is there to judge you. It's me and myself. I was
Yes, that
saying.
I'm so hard on myself as a mother. Yeah, we judge ourselves so
And there is
much.
guilt because as working mothers, every working mother will tell you there is a guilt because your work is your exciting zone, but you understand you're leaving a young child home or in the
Yeah,
nursery or wherever. And again, a happy mother is what the child deserves, not a mother
yeah,
who is leaving her career and everything and sitting and sulking. So again, it is a
that,
game of emotions. Do we enter
yeah,
to understand and find a win scenario that I spend quality time with my child? I come back and there is just joy and pure joy. But that was a huge learning curve.
yeah. What is another thing is about hypnotherapy? What is the misconception that you wish to clear out to
Yeah.
people?
Yeah. That's very important. And thank you for that question. When you talk about hypnosis and hypnotherapy, many people have the conception that it is all about mind control, making you stage hypnosis, because that's what people have the impression of the Las Vegas show. Click,
When I
click, and
was
sing.
young, I thought that is hypnosis. Like
See?
when you go to a circus,
Yes,
and
yes.
then they hypnose like some of the people, and then do this dance.
Vegan.
Yeah,
Yeah,
yeah.
yeah. So
That's what
that's
I
the
thought
biggest
hypnosis is when I was.
misconception. Yeah, that's the biggest misconception about this modality because what people have seen because of media, entertainment, and all of that is stage hypnosis used for entertainment. So, hypnosis is a beautiful, sacred, almost spiritual modality, which
Mhm.
has been practiced by humankind since centuries, I would say, literally. When we look at old times where there is shamanic healing or Native Americans who are playing some musical instruments, there is fire, there is chanting. It's that state which is created, and suggestions are being given in that moment, and
Yeah.
miraculous healings are happening. So it has belonged to us in the healing modality since ages. In the medical field, doctors and surgeons have practiced hypnosis.
They used to do that, but why did they stop? I have no idea.
After World War II, after
Yeah.
Industrial Revolution, the mindset changed
Changed. Yeah.
of people. And
Yes.
that is where stage hypnosis was shown as this, that, and the real use of hypnosis, which was in the medical field, somewhere it lost flair, I would say. But now I am sensing since past couple of decades, medical field is trying to reclaim what belonged to us because it's
Yeah.
not mind control. Rather, we are trying to give your control to yourself.
Mhm.
Because if you are feeling anxious in happy surrounding, which is supposed to be a party or social gathering, you are carrying something almost like you are in trance. You are not seeing where you are. So I tell
Yeah.
my people, I'm not taking you in trance, I'm breaking your trance. Because, hey,
Okay.
look where you are. You're blessed. What are you fearful of? So it's that understanding which I want to give to the awareness of out there, that it is not stage hypnosis. That is one small fraction which unfortunately got highlighted. It is a powerful modality where the control is given back to the client to understand and rebuild their own inner thought formats, belief systems, and self sabotaging behaviors which they want to change. And it's a very navigated journey. I often say that it's almost like you are the driver of the car and I take the role of the GPS. I will
Okay.
navigate you, but you are driving. So the control is with you. And it's beautiful if that navigation is there to take you to the goal because it's a very goal oriented modality. On the other side, if we see counseling and the cognitive behavioral therapies, it- somewhere it's a continuation. Many people would say, I have been in therapy for years, but I have hit a plateau now. It's not doing
Yes,
it should
it's
be.
true.
So
Yeah.
then we have to take a deep dive in. And the beauty about hypnotherapy is it's handful of sessions which can
Hmm.
you or take you closer to the goals which you set for yourself. And
Hmm.
each session makes you go closer and understand that beautiful inner alignment. So it's very time and cost effective in terms of not years and years of work, but say 6 to 8 sessions with a specific goal.
Yeah.
And then that's what we need right now.
So
We
if someone has different goals, those sessions, like for each goal, 6 to 8 sessions.
Yeah. So if someone, many times people come, there is a huge platter of things not working out for them. And I would say, what is that topmost thing which is right in your face right now? You need to address. Many things are there. And they would say, for example, there is a case in my book where this person came with anger issues and nothing was working out in her life. And the tip of the iceberg was anger. Because of anger, she does not get promoted, though she has the skills. She is not seen as a team player. Because of anger, the relationships were not working out because she was married 5 times and divorced. Because of anger, she had emotional eating issues and she had weight issues. Because of anger, we say again, anger is that fire which affects your
Yeah.
digestive system. She had this GERD and all these issues. So she came anger issues, but it had the spokes of umbrella, multiple zones in her life which were getting affected. So whatever is the top thing, you start with that. And in those 6 sessions, that almost every zone has gone down a notch.
Okay.
And that gives the client or the patient clarity. What is that next block I would like to address? Because once that fire douses from within, it deflates many issues which are creating emotional chaos in your life. And that gives you clarity of how things are moving. But yeah, because it's a goal oriented therapy, even though there are 10 issues, we have to enter with one focus,
Okay.
understanding that it will positively affect all the issues eventually.
A question comes to my mind that what legacy would you like to leave behind you that through those different models in hypnotherapy? What would you like to leave, like Dr. Gupte, to be known about, or like her legacy is?
Reem, it literally tears me up because I want this modality in the medical field. I want our medical students to go into the subconscious to heal themselves. We are talking handful of sessions. I want this subject to be taught
Yeah.
in the medical school. We physicians need this. We deserve this to understand our own emotions and to understand and empower ourselves with tools as simple as words to help our patients. We will create a very different brigade of doctors if this modality is part of the medical system. That is what I dream of as my legacy, that I want to bring this modality in and get it integrated fully in the medical system, get it covered by insurance, get physicians an understanding that we can help out our patients more. Yes, we are doing therapies, we are doing many things, but there is something which can help them even more. And that is what I dream of, to educate, to practice, and to Cover it with insurance.
We-
Everything is covered with insurance. Why not hypnotherapy? So many alternative
yeah.
modalities are covered.
I think we're heading this way. I'm hopeful. I'm optimistic.
Yes,
Yeah.
yes. Hopefully, in this
Hopefully. Yeah.
lifetime,
Yes.
this is what
Yes.
the vision is.
Hopefully. Yes. So what keeps you going despite all the challenges?
These miracles which keep on happening to me, like this
Yeah.
interview.
Oh yeah.
Just like when you are at the downhill and you're sensing what? It's like flatline. It comes to all
Yeah.
of us that you come with a mission and then flatline.
Yes.
And you're like, what am I doing? And you are emotional and you are stressed out. And then a miracle happens, which brings your faith back. Keep going. We are here.
Yeah,
Like,
I think it makes you feel like I'm going on the right direction, like
yes,
I have to
yes,
keep going.
yes.
Yes.
And that hope is what ignites the fire in all us humans. If we don't have hope, I don't think we can connect ever to a direction, to our purpose. So, purpose also gives you hope. So, I have my purpose in front of me, but if I don't see my people, if I don't connect to a tribe, if I don't see things flowing, I lose track of that purpose. I start doubting, am I
Yeah.
correctly connected to my purpose? But the moment a miracle like this happens, I am like
Yes.
a Ferrari engine. Go!
Yeah, I support you 100%. I would like the medicine and like the curriculums in universities and in medical school to be changed to have different modalities, different holistic integrative approach more than the modern medicine and that's it. You prescribe medication and that's it. So, another thing I want to ask, what is the underlying purpose of this mission that guides you and guides your drive? I know you said miracles, but what else makes this whole purpose worth it for you?
So I'm not sure how the audience is here because it goes
Mhm.
into the spiritual side of
Yeah.
my own inner journey.
Mhm.
So when something comes to you with a hit of a trauma and it's like the billiard ball gets shifted in a
Mhm.
direction and you feel good in that direction because whatever you are learning, something inside of you is feeling right, as if you are made for this. There is that intuition. Then
Yeah.
it's effortless for me to do this. I'm just dancing on the tune, though I have never heard this tune in this life.
Oh,
So
yeah.
that's where the spiritual part comes in. That when you enter the zone, you understand why this modality, why are you so passionate? Why does it feel like a second song in your head and you can flow it? Because I have been in this modality in many other lives.
Awesome. Can you call a moment or experience from your childhood that significantly influenced your career and the path of your life you're taking?
A significant moment from my childhood. There are small ones, significant, which I feel make me the go getter, action oriented person I am.
Mhm.
I feel. This story was told to me by my father. I don't recall it, but he very laughingly he said that we were traveling in a train and I was around 5 years old at that time, and it was our whole family, three sisters, mom and dad, and going to a new city which is a bit notorious for
Mhm.
things, crime and all of that, though it is a cosmopolitan city, but it's a new city for us. We were traveling there in the train and we come out of the train station and I'm looking and Sonia is not there as we come out. And
That's
he
such
says,
an
my
inspiring
heart
moment.
was like, where is the child? And I'm like, and I'm thinking, oh, they kidnap kids here. They do all the wrong things come to
Mhm.
you. And I'm almost at the verge of panic when I look on that and I walk and I'm looking and I see she is coming very casually walking around and her hands were wet and she's just wiping it on her dress and coming and he looked at me and he's like, where were you? And I said, oh, I needed to go to the toilet, so I walked there and I found the toilet. And
5 years old.
5 years old and in a new city, in a new place, and nothing I know of this place. In that moment, again, how the parent interacts with the child can make or break the confidence.
Yes.
In this moment, if I had gotten a slap,
Yeah.
how stupid of you to venture out on your own on unknown terrain, because we were freaking getting crazy here, that we have something has happened. What my father did, he just hugged me and he was like, please do not wander away.
That's what I do with my kids. Yeah.
Stay here.
Yeah.
And I'm like, okay, not knowing what happened.
Yeah.
And there are such small instances where I see myself in that as a very young child, just taking a step and doing things without fear, which usually is unheard of. And I would tell my husband as well that, oh yeah, I used to hold the hand of my sister and would say, okay, this is the path we are going to take today. I knew that as a child, I know the path from my school to my dad's
Mhm.
shop. And it was quite a bit now when I think of it. And I would just go and venture out. And I was never ever scolded or no one stopped my stride. And I think that's my building block. When I feel that this is what I want to do, there is no fear around me. And
Yeah. It builds the confidence.
we say that if you want to make a change, you have to be bold because
Yes.
it cannot happen without that. So I give all that credit to my upbringing directly to my father, that that confidence was built in me as a child where I am right now, trying to do things with look right. Sometimes it looks impossible. You
Yeah.
go back to Dubai and sit in the clinic and do what you were doing. But
And like for other physicians might look crazy. What is she doing? Yeah. I
yeah,
totally understand.
yeah. So those are my childhood memories, which has shaped the adult I am right now. And some people call me. I don't think I'm a risk taker, but I'm a very action oriented person.
Mhm.
And I feel when I say yes and step into something, it has my full energy in it. And I am a go getter. And that confidence is that building block which was nurtured as a child.
So why do you think it's important to step out of the traditional?
Because there is more we can do. I
Yeah.
know that what I felt as a physician, I know there are many physicians where their sensitivity is their strength, actually. We
But
undermine.
I feel like they are stuck. Like you're blessed to know where to go, but they don't know which way to take. You know what I mean? Yeah.
Exactly. So don't let sensitivity be a tag which pulls down your light. Sensitivity is your uniqueness. Sensitivity has to be harnessed. Sensitivity has to be programmed to come out and give back to the world instead of us feeling that we are losing our fire because people are judging us. And that is what I feel is most important, which this modality gave me because I was labeled as that as well. So I'm a roaring lion as well, but I can tear up very easily.
Yeah, me too. I just want to say I'm taking a long of your time, like
Oh no,
like
this you
extra.
can see how this is going.
Yeah, but I'm very happy. I feel like I've known you since I don't know. You don't I feel like you're very close
Oh,
in like
thank you.
heart, like you're a very kind person. So I want to ask you, why do you believe in the potential of hypnotherapy or the initiative you have? Where do you see what do you envision the impact on the next generations, the future generations?
Um, that's another beautiful question because again, what I'm sensing since the pandemic, the desire of people to understand the emotional explosions is so
Yeah.
much, including the younger generation. So I had the maximum number of patients in teenage group which came in for this because of the isolation during the pandemic. The anxiety, the OCDs, the depression which they were feeling, and the parents being conscious that we do not want to drug the child.
Yes.
We need to understand, and we are looking for someone who can do things differently. And literally in those 4 or 5 sessions to see that child blossoming. I tell this child, you have got a gift for life now because life will throw a lot of curveballs on you. You are just a youngster. You have not even entered into life. But please understand that any challenge which comes your way, the resources are within you. And that's the gift which we can give to the next generation
Yeah.
because they need to understand this. There are so many things out there when we enter into, say, addictions and what all is
Yeah.
available right now, where we say
Lightning. Yeah.
they're getting trapped because no one has showed them any other way. So, by
Yeah.
including this again in young physicians or by including this as a part of a curriculum or something, we are empowering the next generation to understand their challenges and to connect with the resources within. And that's why the title of the book, Within.
Yeah. Within. It's a beautiful title. My last question is, why do you believe it is so important to share your story and your experiences with others? It was by coincidence that Diana told me, read Dr. Gupte book. And I'm like, does she have a book? And she's like, yes. And she sent me the link. I got it the next day. And one day, boom. And it was like, it was enlightening. It was, I don't know. In each story, I had something to relate to. And I feel like that's for me. Many people need to read this book. So, why do you think it's very important to share your story and experiences?
So, the book, when it was conceptualized, the idea was that I want to connect both with the physicians and medical professionals and the patients. I don't want to write a very scientific journal type of book, which and with all those terminologies which we medical professionals
Right.
connect with. I want to reach out to the entire umbrella.
It was
And
a very easy read. Yeah, that's
yeah, so
true.
that's how you see the stories. They have those terminologies,
Mhm.
but then there is a very common man explanation
Yeah.
written to that because people have these issues and they're struggling with those issues. So the book was born out of that pureness of my heart as a validation. I call it my love letter to this modality, which has connected me with a purpose and has brought me to United States to connect this modality with the medical field.
Yeah.
It's a ray of hope for patients who feel that mainstream medicine has failed them and they're struggling with chronic disease. It is a ray of hope for medical professionals like yourself, like myself, who feel somewhere helped and stuck because they are not able to maybe do more for their patients and they need to enrich their toolbox. And it is also for my own tribe of physicians who are at the verge of burnout, who are carrying the baggage of guilt, regret, shame, which I have opened up in the book, my own vulnerabilities. I want this book to be that safety blanket for my tribe of physicians to say that, okay, I take a deep breath and okay, let's explore what all I am carrying, which is invisible, because that will make you a happier, more productive
Yes.
physician, which will share the light with others, which you are supposed to do instead of carrying the burden of the world on your shoulders. I think, our tribe needs that support. That was my calling. When I wrote the book, I was like, my next book, I want to have a group of physicians come in. Let's understand your stories. Let's do this book in the physician way. Let's showcase that we are humans. You know,
I'm a volunteer. Take me in.
we are humans. We feel
Yes.
as well. We have
Yes.
stories to tell, and still we are the brave warriors out there who will mask our pain and will be present for you. No, but someone has to take care of you, and that's what
Yeah.
connected me with PTI. There, the message that our own kind needs help, and I was like, wow, this is what I was hoping for. And
Yes.
yeah, so the book covers all of this, and not only that, but to highlight a modality which has clouds on it. It does not deserve that. It is the purest, most empowering modality any human should connect with because this will give you all the resources which you need to handle life.
And also, you have an upcoming event in San Diego, right? If anyone is interested,
Yes.
Dr. Gok it has an upcoming event, and tell us a little bit about it.
So the event was created once again for the medical fraternity.
Mhm.
And it's almost like I've created a mini toolbox for each
Mhm.
person, not only to understand the mind body connection, but each segment which I have created in this 1 day event has either experiential understanding for you to go within the system to understand things, or to understand disease in a different perspective and have again another toolbox with you to
Yep.
manage your own stress, to not go towards a burnout. So it's almost like an introduction to a vast ocean of knowledge, which I can talk about in my sleep, I would say. I live and breathe this modality. I was given 1 day and I was like, oh, it's really tough. Okay, let's make it worth it. So it's exciting stuff. There will be a lot of discussion. There will be vulnerable moments. There will be sharing of life stories. And we will box it together in a very productive day where you will go out feeling enhanced in your mind with beautiful tools, life skill tools to help you as a physician and as a person as well.
Awesome, awesome. And you have a website. You're a founder of Insonia,
Yes.
right? Yes. If someone want to check it out, we'll have it under the video. It's a pleasure meeting you, and I was lucky. I would say the universe connected me to you, and we are so blessed to have you at BTI. And I'm excited to see you next Saturday.
Super
Yes.
excited. Thank you so much for your time, Reem.
Thank
And
you. Thank
yeah,
you. It's my
may
pleasure.
this be the beginning of something big, which is waiting for all of us.
Hopefully. Thank you
Yeah.
so much.
Thank you.
Have a great day.
You
Bye
too.
bye.
Bye bye.